You walk into a grocery shop or a provision store, and as part of the items there, they've written good health. What would you do? I'm sure many of us will rush to buy this item, irrespective of the price tag attached to it. But unfortunately, good health is not something we can buy at a supermarket or a grocery shop, which is why today I welcome you all to Health Matters Show. Here, we bring you accurate information and knowledge that will serve as a stepping stone for you to get good health. I'd like to apologize that I'm having a little bit of temporal voice loss, so my voice might be a little different from the previous ones you know. On today's episode, we are blessed to have two gentlemen on Health Matters Show. Today, they will join us to have a conversation about diabetes mellitus. What is it about? What it brings about it? The preventive measures to go about it. And together, we will all be safe from having diabetes mellitus. Today on the show, my lovely viewers, I want you to join me as we welcome our guests for today's episode on Health Matters. But not to forget, I am in the person of Miss Inseidu, and I'm your host for today's edition. And on today's conversation, we are blessed to have on the show with us two gentlemen. We have one in the person of Mr. David Tufo. He is the senior dietitian at Escado Government Hospital. And Mr. Emmanuel Lati, the Western Regional Non-Communicable Diseases Coordinator. Lovely viewers, join me as we welcome our guest for today's episode. Mr. Tufo, you are welcome.
Thank you very much, Bernice.
It's a great pleasure having you on our show.
Likewise, it's a pleasure.
Thank you so much. And to you, Mr. Lati, you are welcome.
Thank you.
It's
Thank
really
you.
great doing this with you again.
Sure.
Last week you were here with us, and this week too. We appreciate your presence a whole lot.
Thank you.
So before I come to you, my lovely guest, I'd like to speak to you, my lovely audience. I'd like to ask a question. Yemum dodowahin na ya check yen blood sugar da. How many of us have ever checked our blood sugar before? Show by hands in the comment section. Also, don't forget to subscribe. If you haven't subscribed, to become part of our family, don't forget to like, to share, and then comment in the comment section. And your comments and contributions would be greatly acknowledged. Let's set the ball rolling. Get all your tools, your pens, your pencils, everything that you need to note some things down for further references later. So to you, Mr. Tufo, my first question goes to you. There's a saying that eating too much sugar brings about diabetes. Is that true?
Well, thank you very much. In fact, I get this question a lot in the consulting room, at the ward. Several places we interact with patients. Okay. And my response to that is it's neither here or there. It's a very simple matter in the sense that eating too much sugar is not the direct cause for diabetes.
Okay.
However, you may want to look at it as a multifactorial situation or condition, okay, where diet plays an important role in causing diabetes. When we look at too much sugar consumption, it's a thing that is becoming on the rise. And if you look at the world globally, it starts from what we say sugar being included in every part of our diet. And when we look at your breakfast, your lunch, your dinner, people consume sugar in different ways. So a typical example is a Ghanaian breakfast like Hausa Koko, where we would have some sugar in there. If this individual should go in with another combination like bullfruit, they will also have some small amount of sugar in there. So in this case, we are talking about table sugar. So we are not talking about the end product of digestion of carbohydrates, or let's say the complex carbohydrates, which are equally simple sugars. So this table sugar we are talking about here is widely consumed, and this individual wouldn't end with the Hausa Koko and bullfruit just for breakfast. they will end up eating probably rice later in the day, in the afternoon. And on top of the rice, they will have a sugar sweetened beverage, and that's another sugar there. And then in the evening, assuming they finish having their dinner, they may end up having some snack, dessert, maybe a piece of chocolate or some cake or something like that. This equally has sugar in there. So in total, they may have consumed a lot of sugar in the entire day. However, can you blame this three different consumption of sugars in different three meals as the main cause of diabetes? Certainly not. It's a contributing factor. I mean, at the end of the day, you're looking at excess carbohydrates coming from these sugars. If you look at the energy sugars delivered to the human body, it gives us a lot of kilocalories. At the end of the day, if these individuals' energy needs are overseeded, or they consume excesses of this carbohydrate that we are talking about, then this excess carbohydrate in the form of the table sugar will end up causing problems for them in the future. But in the interim, it wouldn't be the main cause of the diabetes that we are talking about.
Thank you so much. So now we've gotten to know that it's not the eating too much sugar that causes the diabetes. So I would like to come to you, Mr. Lartey. So what then is diabetes? What comes in mind?
Okay, thank you very much. So when we talk of diabetes, we are looking at a metabolic disorder. So where any of these three things can happen. Where one, there is too little insulin produced.
Okay.
Or two, there is no insulin produced at all. Or the third one, the insulin that is produced is ineffective. So when we talk of diabetes, we are saying that it's a metabolic disorder where the body produces too little insulin or no insulin at all, or the insulin that is produced is ineffective. It's not doing its work like it's supposed to do. So we can bring it down for us all to understand that Edanna oswono is the tissues or the cells of the body. That is Edanno. Now every house has a door, and the door has to be opened with a key. So the key to that house or that door is insulin. And then the people that will enter that house or the human beings is the glucose. So if you're having a lot of people standing on the streets or at the back of the door, we need insulin to open that door. So when insulin opens the door, the people rush in and it fills the house. The house is more energized, there is more party going on. But without the key, without insulin to open that door, everybody stays outside. And that is where we say there is a buildup of glucose in the bloodstream, because they have not gained access into the cells of the body to give you the energy you need to do what you are supposed to do. So basically that is it.
Types of diabetes.
Okay, thank you very much for that. So there are various forms, but we know of the three notable ones. We have type 1 diabetes, type 2, and then gestational diabetes. Let's look at type 1. Type 1 diabetes is where the body itself destroys the beta cells of the pancreas. Actually, it's the pancreas that produces insulin for us. So by whichever means, the body targets its own cells or the pancreatic cells and then destroys it. So in that vein, the pancreas is not able to produce insulin at all. So there is no key to open the doors to the cells. And so when this happens, it means that there's going to be a buildup of glucose in the bloodstream. So the only way to deal with this is for someone with type 1 diabetes to be given insulin shots. And normally type 1 diabetes occurs in young children and the adolescents. That's what the class of people normally occurs in. So we easily detect it in such groups of people, young ones. The type 2 diabetes is basically lifestyle mediated. So it's caused by your lifestyle. the way you eat, the way you exercise, the things you eat, and all that. When you eat, your energy levels, the lifestyle you lead. And so, what happens is that the cells within our body are known to a certain level of blood glucose. And so, the moment we eat and then it is broken down to glucose, there is a signal to the pancreas to produce insulin. So insulin comes in and picks the glucose that is in the bloodstream and then sends them into the tissues to give you the energy. But when you are consuming the foods in excess, like the sugary drinks, the excess carbohydrates in your diet, without doing anything, without exercising, you are not burning it out. What happens is that instead of the body having this level of glucose in the blood, now you increase it to another level. Now, the more you produce insulin, they go and bring it down. It gets to a point in time they become tired and fed up. So now they begin to accept that higher level of blood glucose as your normal blood glucose level. And that is what we term as insulin resistance. So the insulin resistance is the type 2 diabetes, and that's what you call as the diabetes mellitus in the medical field. But that is the type 2 diabetes because your body is now resistant to the insulin. So we can't do anything. And so insulin becomes ineffective. It doesn't cause any change. You open the door, but nothing happens. For the gestational diabetes, it occurs in pregnant women or pregnant mothers. And this one happens somewhere around the 24 weeks of gestation or like 6 months going. And then that one too, that level of protection they have a certain level of protection, but because the placenta is there, the placental hormone also has a covering or effect on your insulin, and so you are not able to regulate it well, and that leads to the diabetes in pregnant mothers. But the good thing about this one is that after delivering, if you're able to adhere to advice from your dietitian and then your lifestyle modification is also good, you come back to your normal state. You don't tend to have the diabetes again. But then you are at a higher risk of developing type 2 diabetes if you don't adhere to proper lifestyle modification and advice from your dietitian. And the child that you are going to give birth to also has that tendency of developing type 2 diabetes later in life.
So now we've gotten to know that. And I like the last part that he talked about with the gestational diabetes. So please, to our dear pregnant women and our mothers, let's do well that after delivery, we will abide to the lifestyle modifications that will be given to us by our midwives and then our dietitians in order to save ourselves and our babies from getting type 2 diabetes. So this question is open to both of you, please. My next question is, how does the body normally regulate blood sugar?
Okay, so like we said in my earlier explanation, the moment we eat, there are signals to the brain that food has been broken down into glucose. And so it needs to be absorbed by the body. So what happens is that the brain signals the pancreas, give us insulin. Insulin is what collects the glucose into the tissues to give the body the energy that it needs. Carbohydrates is broken down to glucose. Okay. So anything we eat, when it enters our body, the system breaks it down to glucose. So the moment there is glucose spike in your bloodstream, there is a signal to pancreas to go and then clear the bloodstream of that glucose spike and bring it down to normal. And that is how the system is. That's how the body tends to regulate blood glucose. Yeah.
Thank you so much. So my next question goes to both of you. So, what causes diabetes and who are the people at risk of getting diabetes?
Okay, so I'll take some. So the people at risk of developing diabetes, one, if someone has a family history of diabetes.
Okay.
So that is to say that if your mom or your dad like hypertension, or your immediate sibling, your brother or sister has the diabetes, the tendency of you developing it
It's
is
high.
high. So
Okay.
that is one undisputable fact. And that is because the moment, let's take it, I develop diabetes, my genetic coding changes. And this genetic coding is transferred to the children I'm going to give birth to. So that is what predisposes them, or that becomes the risk for them
Okay.
developing the type 2 diabetes. Another one has to look at the lifestyle that we live. So the sedentary lifestyle we live. I know of someone who would sit at this very place, eat, and sleep. Someone who also finishes eating, wakes up, moves from the house to the car, from the car to the office. When you get to the office, you are just sitting by your table and your desk, computer, close back to car, car to house. So that kind of lifestyle where you are not physically active also predisposes you. Then another one is obesity. Obesity is also another factor that can predispose someone, or a risk factor, because then when there is the buildup of fat, visceral fats around the organs, it masks, or it renders the effect of insulin null and void. It makes insulin ineffective, and so that also tends to cause diabetes. Obesity is number one risk factor. So when you are having excess weight too, it causes it. So it's not actually fat people only who can develop diabetes. Even a slim person who is overweight, like me, can develop diabetes if the lifestyle is not right. I think my boss will add the diet aspect.
Build up from conception. I'll start from conception because maternal diet even affects the child. And conception includes the first 1,000 days of a child's life. So whatever the mother puts in has a way of influencing or affecting the child's growth, child's risk of developing certain disease conditions in the future. So let's say as the mother is pregnant and is almost always on the verge of consuming everything unhealthy, this increases the mother's risk and also that of the child. Now, this child comes out during after delivery. The mother did probably exclusive breastfeeding up till a point and then started complementary feed. That is where the problem also starts, because exclusive breastfeeding, super, the mother may have done everything that we recommend for mothers to do. Now, the complementary feeding, if the knowledge is not too great, and mostly that is what we see, we have all the errors starting from there. So mothers starts feeding children with what we call sugar laced cereals, and that is where the problem starts from. So my boss spoke about obesity. Current trend is now we are producing obese children, obese infants. Yes, so it starts from the complementary feeding, and this is compounded over a period of time, accumulated over and over and over. I'm not talking about the first 10 years of the child's life. It keeps going over and over. If this child is not lucky, they may end up getting the type 1. And my boss explained earlier as the very common type among children or young adults, adolescents. The other one will be if this dietary lifestyle over a period of time does not, get better, compounded over a period of time, would increase this child's risk of developing obesity. Okay, so excessive sugar intake, excessive carbohydrate intake, energy intake becomes not balanced, where intake supersedes expenditure over a period of time, compounded, like I said, would lead to this child developing obesity. This obesity increases the risk factor of developing diabetes, because now another angle that you may also want to look at it from is the child may have excess fat, adiposity and all that. Sometimes some of these fats ends up in circulation as bad cholesterol, LDL cholesterol. This cholesterol also increases your risk of developing diabetes by making your insulin insensitive, because they end up blocking receptors that receive insulin, thereby making your body regulate insulin better. So as these receptors are blocked, then you become insulin insensitive, and your body may produce just adequate amounts of insulin to help regulate your glucose levels. Unfortunately, because of insensitivity, you end up developing diabetes.
This one thing, like he said, in the kids, in the younger ones, I want parents to take very critical note of this, because we are having children who have now developed type 2 diabetes because of what he's talked about. Now, someone will say that Musano Brenna me brena and Zamana mean di menyan Jane me babe bread them. So now they want to feed their kids with everything sweet. These kids too go to school, less physical activity, comes back home, is sitting behind the TV game, playing the game, watching cartoons. It's not playing like you used to play when you were kids. So you go outside, you play football, you do the putting and all those games, plenty things that we used to do, Chaskele and the rest. These kids are not exposed to those things. Theirs is just sitting beside the TV, watching, and then cartoons and games, playing games. And so they tend to grow fat, become obese, and ubana fine, and you are happy about it. But this, you look at the weight of the child, and the child is weighing like an adult.
Yes.
Okay, so you can see a small boy having the weight of an adult. Even when the child falls sick and you want to give this child the medication, you can't give pediatric doses or then an adult dose of the medication. And this is one thing we need to look at, because at the end of the day, the child can develop type 2 diabetes in that younger stage. And the effect of diabetes to the organs is that. So that's one thing we want parents to take note of.
Please, our dear parents, we are really pleading with you, just as Mr. Latte has said. Let's try and then help our children so that later in life they wouldn't suffer for what happened during their childhood stage. So the conversation still goes on. Don't forget to subscribe, like, share, and comment in our comment section. And then your contributions will greatly be acknowledged. So this question goes to both of you. Please, when should somebody get tested for diabetes, and how is it done?
Okay, so one, I'll start from the pregnant mothers. So we are expecting that when they start their antenatal care, their blood glucose will be checked. If not at all, at 6 months of pregnancy or 24 weeks of gestation, we need to check their blood glucose to know their state. That is one. And then the moment you hit the age 35 and above, anyone from 35 years going, you should get your blood glucose checked. And then if there is a family history of diabetes in your family, there is that family history too, you should get checked. And then maybe we'll talk about the signs and symptoms. So if you also see any of the signs or symptoms of diabetes within you, just move to the nearest health facility and get checked.
Thank you so much. So just as you said, we are coming to discuss about the signs and symptoms of diabetes. How will somebody know? Test na
okay, that's it. Into no one, a swanche pa or wha a bo swanche dama, inya swanche, kakrana swanche do. So that excessive urination is because the glucose now build up a lot and they have not entered into the cells. Now the body needs to dispose the main glucose off na mogya no ma da hɔ clear. Another way the body will have to use our filtration system, the kidneys. I always say that where sugar is, water flows. It will now dispose the glucose into our urinary tract system. And so now, just to pass out the excess glucose in your blood. And so that is why you urinate a lot. The second one has to do with excessive thirst. So we call it polydipsia. And it makes sense. The reason is that as you pass lots of urine, or so you need to find a way to replace that lost fluid. So replacing it means that and the funny part of it is that and like joke, you can sit here right now and gallop like 1.5 liters of water at a sitting, and then still pass the urine. So these are the signs. Then the last one, which is notable too, is going very hungry. Although you have eaten, and when we eat, understandably, glucose has to be absorbed, you gain the energy. But this particular person, you are eating, but still, you are not getting the energy you need, because the glucose, instead of going into your cells, is in the bloodstream. You are still weak, and so you still want to eat to get that energy.
And obesity will start it.
And then when you are eating you are not getting weight. So now you are also experiencing an unexplained weight loss. What do twa or to? ADD, bibia, but what do twa or to? Onye de your baby another baby. You are very fit, but the moment you experience that unexplained weight loss, then it should tell you that the glucose, there is diabetes somewhere. So you need to look at that. These are some of the basic signs that you could look at. I don't know if David would want to add more.
Yes. Thank you very much once again. So, a few things that probably you may want to look at is where I would, yes, from Mr. Latte, dietary aspects, on it there. In Pempi, say, edidi. Nehu de oncha na ekomodo etekom na edidi encha na the komodo or one of the major concerns here, and this is because to them mono them insulin resistance na okodo nipadua no will affect a lot of these metabolic processes. Nti obandama ohwadwen edidi a ebonda oncha na o deposit na o glucose stores no why loose afi the oko why do oni ho oncha na edidi so na still at the komodo na ehwe dama you may end up eating, and this will also end up contributing to keseye no or obesity no. Nti keseye no so record no na eche the fat deposit and make and adiposity no ono so or record. So bandama no why one problem leading to another problem. Them concern no ohia pa de ye be hwe them signs and symptoms na se bibi wo ho a o de ya to ho na montentema ye hu them signs and symptoms no.
Ye hu ya ti ye hu de ye experience nyoma wa bobodi bia na ntamara do ya ko nearest facility a obene na wetim wa ye no. Pen bebre ni say yakọ hospital there ye be check ye ni esichire dodo a wo ye ni mpedue no mu a ya wo ye ni nsa no so wo ye nsa no we a ye hu there numbers bi wo ne machine na we use no do me hwe wo mo betim a church the me numbers no wo do no mu.
Okay. So numbers no chere as to whether obi enya esichire yareba ni bi another onye bi. Into no, yes, numbers no in this vein or your groups. There have been several categorization, but I want to go with what we are known for currently within our country, which is so simple for us to remember. Aying in a ebeke. You were normal. Now you be your friend pre-diabetes. ansa na ebenya diabetes na or diabetes na nkasa. Into no in other jurisdiction or in our jurisdiction no yɛbɛka dɛ we check na sɛ sugar no or below 6 yɛbɛka kyerɛ dɛ normal, but even the normal no although you're from 4 to like 5.6,
Okay.
but then you didn't know they're below 6 or normal, but from 6.1 or 6 to 6.9 on the FN pre-diabetes. Into your corner, we check with sugar. Then what also with sugar now is 6.3. 6.3 is normal. Only a pre-diabetes, meaning that say and show who ye ya ebenya esiche yerba.
When the mystery be out, is it like what check no a doctor na who day or 6.3 na or remember me with the
Oh, there be. Into no what check no a doctor the next day, and you are falling within that 6 category now. That's where we are making you think that is pre-diabetes.
Okay.
We don't normally see say ensure that engine just one glucose check because your confirmatory test are already and sana academic no wo esiche yerba. In canon na test one so but CCR no on the any condition na enyama bebre sisa. We don't want to put anybody through excessive stress. And what we do is that in your condition, you check and say our sora, we do a confirmatory test. Into no pre-diabetes, and you may take 1, 2. But then I don't know, I have food to need more. This is the times you need the services of my boss here. I bet show more there a year. Nkofu be break or hospital, but they don't visit the dietitian. We check no cardio 6.8, 6. Also I fine. No. And show who ye are ebenye siche yerba. Into between 6 to 6.9 your pre-diabetes, 7 and above your diabetes. Into your check na enya 7.0 or your diabetes, 7.1 drukoni in actually diabetes. But that one you better confirmatory test account and sana.
Thank you so much. My next question is, what are some of the lifestyle that if we do, it will help to reduce diabetes?
Mesa kakra fi ha.
Okay.
Ya share lifestyle la. Oguma hodo pi. Mama ka ho asam no ye diet. Mo boss rekasa no ka bi wi da nkofo pi wo bokwa yarsa bia wokọ na wokohu doctor wokohu medical team na mpempi wokada wokohu dietitian aya wo mpeda wo beba. Sentin ne den. Sentin do dinkan. One way or the other no obia interact with food before one nimbo for be ma de benyin iti no oya nimdi of it ban ho de ankwankro bia wo bi biom oya mpempi nkofu suro de wo ba obaka cho na mu wondi wona akono de anade mo no kondo de wo bedi iti mpempi no so oya won pede wo ba bet dem kasa no but wapom den so de no ho hia papa inti dietary part no ehwe mosa otena enya ho nimdi oye edidimdi no hye ho na ede bo bra so a oye oboa ma etim etoto edibandi ye se ebetena achar na ebe prevent diabetes from happening na adekura no ho hia papa ye kwana ebe fadu bedidi osande ebetima nom diabetes nduro wo wi ase nyina edibana ye den no dodo na akowie esichire wo ye mojem ono no affect ye glucose levels ono mo kire de benya diabetes anada bi nti hu kwana ebe fadu ebe tutu edibana ye a no ho hia papa osande oboa ma ehu ma ebedi ma ebotwe ho efiri ho mbera wo de ididi edibana dodo wo de edi dem e ba say na ye de manage basically obi a or diabetes another obi opera prevent the onset of diabetes for a long period of time. Nti ebe fan kofu ebien ekor ne diet no okoye ne kada okoye on ye by yen standards na obi so ne de onkoye ma ne diet no koye no with time no ebehu de se our family history mpa them risk factor no or reduce kakra wo ho versus obi a ne diet no onkoye a osan wo family history dentia because ye wo bibi wo diet mo a or turn on disease causing genes bi wɔfrɛ no acetylation and methylation wɔ pɔtɔkasɛm no nti no sɛ ehu kwan ɛbɛfa do ɛbɛdidi a ɛbɛ switch off them gene causing diseases na ɔboa nti yɛhyɛ ase free nindi na ewia ne yɛhu one thing knowing the knowledge, another thing applying it. It's a nimdina, area na yaba application no. Obi wɔ ha ɛbɛkɔ no ɔwɔ nimdina no knowledge ne kakra nanso application no bobo onkoye. Nti ohia dɛ daadaa no ye ɛbɛka dɛ sɛ ɛyɛ newly diagnosed but that first diagnosis na yɛde hyia dietitian no twetwe nkɔmɔ fa we de bandim. Na area every 3 months bia so ɔdɛ enya interaction with that. Because time a we si twe no ɔbɛda din. Nti dietary part no ohia papa de se sora napa ewiaber enwumber ehun kwa na befa do ebedi nkofo bo we pay as you go based on one diet no oni plan bia osora napa mother table do no obedi ana mo ofie no wodi so endo obandem osande apomuden dem no ede intentional ede eto ba de toto ho anapa ewiaber enwumber ediban kora eredi mbra ebedi ediba no dodo eredi how affect glucose levels you didn't can be before carbohydrates na sugary foods ho wansam onye sugary food nkoten carbohydrates na nkasa mpa oye mekan the primary source of energy for the human body no onu sumpo otim cause problems sande omo energy ni wia oye glucose no da mo nti glucose no body no e do hu most obeda na carbohydrates no guma ahodo pi so that mosa ebe didi carbohydrates ebe select more complex how affect glucose levels proteins fat and oils more complex macronutrients no you have micronutrients also how affect glucose in a nutshell no mekan the fruit obi o ha obeka cho the diabetic only do the fruit because fruit bi wa numu ye dodo ebi ya brobe numu ye do mango numu ye do ntono odi mango na ya obama sugar akosoro so betina ho month in month out 2 wonder we do 1 year na fruit often fruit e bin kana also ma deny a very important micronutrient anka e benye free fruit no mu enkonya free protein enkonya free carbohydrates and fruit no kote no be deliver them micronutrients it's them nimdi ameke no hu hia papa there ye butu ho anamo na yenya ye da hye nkotokum na ye da aboye mbra
anything to add up to the lifestyle modification?
Yes, lifestyle no so no exercise or here pa to that American earlier somebody would eat and sit there them. So we want you to after eating be active. So 30 minutes a day for 5 days, 150 minutes a week of exercise is good. Physical activity. Edidi we are sorry na twitwa wo chance sorry na pra wo fie. Sometimes for one self reward the up and down movement on the stairs, those nyaman kitten just move the body. Join a club, exercise, do something that will burn the fat. One thing research actually in there, when you exercise Odu baby, you don't even need insulin to pick up glucose for you. The muscle itself will pick the glucose up by force because we're here. Okay, so the more you exercise, it helps to pick it up. There is one muscle, our friend slowest muscle, or the I don't know, say, say, it's no onando. It helps to absorb glucose faster for you. Instead, they make calf raises. Helps in doing absorbing the glucose. So that is one thing we would expect that people do. The other one has to do with weight loss. So we talked about obesity or overweight. In this home you do say and more than so. Because the more now you are burning the fat down. So when you burn fat down, you are also giving room for insulin to become effective, to function as it's supposed to. So we want to talk about weight loss, losing your weight. That would also help. For people who are already having diabetes, diet is number one. Weight loss is there. And your medication. Say, and for weight or there for insulin or there. And there are some people who choose to give the insulin at one point because now they don't no longer feel the pain. And there were pania or some way. But somebody will say that they be over how in your wow my sister over no any yo until one up there be you are not absorbing anything. You are just injecting into heart tissues. So always visit the hospital. Let the nurses teach you what to do, what not to do. See your dietitian all the time. Regulate your diet, exercise, and we are good to go.
So much. So from the conversation we are having, this makes us understand that there's really a need for us to visit the dietitian. Not to say, oh, it's bano, easy, yeah, the nutrients in it. There's more information we don't know yet. So please, as part of our day-to-day, regular or monthly checkups that we do, let's try to visit our dietitians for more knowledge and information. So now we are on Mr. Tufo. I the baby I you be here. One pa. My name Renu Sunti. My next question to you is Nkofo bebre kade dem braye hunu se mizizia na mi sugar no obekosoro. If I'm to eat banku because of the end product being glucose and then it's not being sent to the specific place it should go, it will go up. So if I skip meals, is it a best practice for me to lower my blood sugar?
Thank you very much. Them question end of the year, not most patients be them, whereby the no metabolic syndrome, both diabetes, hypertension, and many didn't come on or try did it 2 times a day. Needs bandisha say we are about 12 o'clock. Na last meal of the day, so we the evening time. Teenager there from time or sorry and a park up 12 no on didi. Na mi bisan no can be there or a pensioner. Sometimes no or den kakra some no own team did it 3 times a day no 2 times a day no, to be able to afford a banana wood na a hono or mamutre na dream begina do there 2 times a day no rather no or cause problems than even 3 times a day. 3 times a day is better in other words. Didn't ya? Nipeduane ye machine, effective machine. To the car, yet to full car to be able to move the car from one point to another. Into ye machine in continue the yansu ye here yan source of fuel. Fuel la ye do guyan nipeduane muno or ye ban. It ban affect glucose in so many ways. To be all diabetes, so I skip them breakfast and our lunch and I'll skip in the banibia or boa sugar no kofo mana. Response to me very simple. Escape breakfast or my commodore. A commodore lunch and you may end up eating more than necessary. It could be more than necessary. Glucose levels because it's because of that I recommended that we the ban spreading across 3 meals to allow for a proper digestion and gastric emptying. Oshas if you anapa recommendation the edasora within 2 hours after waking up with the banodin can fakawano. Ubu hobeka cho the ono onye morning person until ono anapa de wasoro do ndi breakfast na aha na pa ono no obedida wa ye na adinye wi especially amamefo no opedo ye na adinye ohwe fie ohwe mbofa ba no prapro ye na adi bibia wi ansa na we di ne di ban te bo ndem bro na akọ n'enim te obi a osoro anapa 5 o'clock am and 5:30 am obedi ne first meal of the day no about 10 another 11 oh adwen no mo war pa and research chira hwehwem chira 1 hour skip first meal of the day, one risk of developing type 2 diabetes, or SOPA, because they end up having LDL cholesterol being elevated. Then period, and for BB gluconeogenesis, making or breaking down or formation of new glucose using non-glucose substrates. It's our amount where the banana nipeduane di jumano, but in alternative. We're breaking it down, or they produce energy, but because juma energy. Inti the body no a drag in them. Body no when the name told that ready, crowd there will be didi. It's about to share alternative. A can offer the oil dam or elevate cholesterol with time. In a basha one was skip breakfast and be brain or elevated cholesterol level. How does this cholesterol level affect glucose or lead to insulin insensitivity? It's thereby we develop diabetes with time. It's yesha say it's and a do breakfast within them 2 hours after waking up now. That's the window period that prevents our body, from breaking down them stored fats to produce energy for you. It's them that thereby I set the ball rolling for the other meals to also follow, or lunch to follow, or dinner to follow. First meal of the day within 2 hours after waking up now. Yes, there a second meal of the day, 5 hours after the first meal, because sometimes our body they break down. Friend and the banner assimilate nutrients, and ready for the next meal. Them second meal of the day, so we are 5 hours interval after the second meal. Na the third meal of the day. Now, a realize uncle phone ni eating times. Into on one no would the first meal of the day. I say reach no conda no I to be no way. Your problem of eating in between meals so Message the honor your especially for be or diabetes. You need diabetes or sumpa. This is the way to go. Extra napa in between meals. In your major meal or your eating discipline. In your first meal of the day, anywhere. Na ewie na mfa bibi nka wan no biom the bibi beka wan na nsu beverage nsu particularly not just any beverage nsu because water is still beverage nti enum nsu a ewie twan one next meal of the day na edidi then the next meal na it follow them finger foods na all them spikes glucose spikes no and once again obi all diabetes oba ha na adwempa ti ewie them meal times na afide e be di ba no da nti ban bi o affect glucose channel bi your carbohydrates generally one end product of digestion glucose in fact your hospital there check your sugar your share on your sugar there your glucose specific type of sugar be individuals here can one say me them complex carbohydrates it be affect glucose in a negative way be your food of high glycemic index one will elevate glucose level within a shortest period of time after consuming them, and then it stays up or maintain them high value over a long period of time. You penny them. Them high glycemic index food, usually a diabetic not by an catch out there about if or just a few ones be. Now, a focus more on the complex carbohydrates.
High glycemic.
Yes, indeed. It's a few examples here. One, table sugar. Table sugar is a whole concern kakra more on there. Bohun there will be a diabetic also on the white sugar, but the brown sugar. Another a war honey. Also concern kakra honey. Generally, all table sugars, brown or make the all natural sweetness. Both honey, brown sugar, and white sugar, were an example of food of high glycemic index. Ibiom edibana wa popodo, weji in tetanefrim, and I make the heavily processed food, industrially processed. Nti otaye oye isam, white flour, and ni products are what they nti pastries, biscuits, pano, na moka noodles, pasta, spaghetti. Onya were examples of that. Macaroni, onya were examples of high glycemic index food. Na last, cassava, banchen, na no ebusunyoku ni nyina exception kakra wo homo fufu. Osande betimi yake kanze mebi abon fufu no onya banchen kote ne ye de ye nti betimi de bread account bread no ohye fufu banchen no da oyemo. Nanso nke na oka ho no gari kokonte tapioca yakayake acheke agbelema bancheka kro banchampesi them squad also were high glycemic index food. Say yes a phobia or diabetes here but now or poor sugar control no the individual any diabetes no on timidity a quan or hopper to them exceptions if you are more kana diabetic patients timidity. It's a few examples of food of high glycemic index. No, now you best so that all diabetes in there with the bandit bear one way. That be on there make them high glycemic index food if you are. Better more over 20 examples of complex carbohydrates. Better made. I better my dan Obama with the banwa a varied diet. It's a be a santum. No more dog. Entire uncle food there will be especially diabetics. A bit medium or a complex carbohydrate behave the same way cassava products behave. Another example, a bro no what in the bampi, what they dokon, what they abede, etzel, what they okana banku nti ebro no de yetimi edan dem ope yesanso ba bayer ana edwo aha ono so another complex carbohydrate diabetic patient betimedi bread ho de na mpeda nka mobodo osande diabetic patients in almost everyone who nya with the bread pa it's like one go to source of carbohydrate but here just a few examples to mention betimedi emo oya diabetes so sremo pa especially white rice betimedi white rice betimedi offend brown rice betimedi local rice yana muni nyina etimedi iti here complex carbohydrates na side no na yeba proteins no so all proteins no one directly affect glucose levels into all the proteins but you recommended the be lean proteins rather than the saturated fat ones no masrade ana odangwa pi no nsumu nam akoko na michefua na beans and kati plant protein animal protein say about fat and oils no so ono so yetimi yedi na finally no oye micronutrients na eho na oye game changer no oye vegetables and fruits na ho ye nya micronutrients fi vegetables yi ye de efroye ye de yankwan ye de kafroye ho ye twitwa kankwan ho nti fande di ban bi de fufu na benkwan diabetic obetimi da njo obetimi di papa onya ne fufu onya na abenkwan na edo hu combination portion no most obeyen abenkwan no nya abenkwan de ma keke abenkwan no bobo modern de obenya oye ntroba nkruma ntropo bi odakeka ho oye vegetables oboa or reduce the effect at which are carbohydrates no oye fufu no or the sugar no bokosor nti why the police and thief police wo ha wi no ontimu nko wi ade dem aha ti say you stadium na stadium no police for age stadium ne fa na wo de wi fufa ba stadium no so obey e din because echo catalyze another reduce the effect of the other. It is important there maintain a very good vegetable intake over the complex carbohydrates obi so obeka on them that much ho fi carbohydrates ho as a complete way of reducing my glucose levels ne dam na ebetima akọ hypo bidin kankan there carbohydrates or body's primary source of energy body the only time I will choose any other macronutrient over carbohydrates a time I war crisis mo it be a starvation famine and there be a commodity na there a year pass sickest of the sick the bampo ntimundo kon 3 days in faith bank on a body be prioritize other forms of macronutrients or they produce energy but until the body the primary source of energy carbohydrate it's intim kede you carbohydrate di because glucose levels was so here there you share na ya to na dem na ehun say beyen
wow nigid dey ehun ehia de o ho do se dey yekohu dietitian waka bebre but say ekohu na bebre so wo ho a ibetim na ati. So I'll urge my dear people out there who are having diabetes mellitus. It's not like you can't eat all our traditional Ghanaian foods. You can also enjoy them. He made mention of fufu. You can eat your fufu. But we should try our possible best to know the kind of food we can eat because there are some that are of higher glycemic index. Ebi me bema yeni glucose akosor. Ebi me bema wa akofom. Nti dembra wa bobo ebi mo ewo ne kase mu no. Let's try and pick those examples. Then we will be able to regulate our blood glucose. Back to you, Mr. Tufo. It's like baby I yedru is ban some no do pa send a hono so ho hia ma hien ankasa. I would like to ask again. You said we shouldn't be eating in between meals and we should try our possible best to stick to 3 square meals instead of 2. So what are some snacks that you would recommend for somebody with diabetes mellitus?
Right. Thank you so much. Snacks to recommend for somebody with diabetes mellitus is basically fruit options.
Okay.
So usually when you talk about snacks, people think about sugar sweetened beverages and pastries as snacks, but that's not only what you can think about. You can think of kose as a snack. You can think about peanuts, banana as snacks. You can think about a medium size of apple as snacks, mango, half a medium size as snack, a wedge of watermelon as snacks. These are healthy snacks that deliver proper nourishment to the human body, micronutrients and dietary fiber. And like I mentioned earlier on, when you eat in between meals, if you are not careful, you may spike your sugars depending on what you are eating. And these are the snacks that deliver little for more value. It delivers small volumes of food, but at the same time, it's spiked with nourishment and a lot of goodies. So as you are eating fruits like orange, like watermelon, like once you are staying within the recommended intake, that is likely to be given to you by your dietitian, you realize that you would have obtained a very good, nourishment without spiking or elevating your glucose level. So these are a few examples that I can think of at the moment.
Okay. So it's not only about the bigo cola, the champagne,
Yes.
the pastries.
Yes.
We can also enjoy snacks. To be share home. Uma yen mama on kede yen sugar be consirinti, yen di mango, yen di impua. We can eat it, but of be portion control. Yen huza, ye betim na yezi. Ama onfan sunsandu bon biara, onfan bread them yeni nimpediano. If you haven't subscribed yet, please do well to hit on the subscription bar to become part of this family. Like, share, and comment. Do well to send in your questions as well, and we will surely attend to them. We are about bringing our conversation to an end for today's edition. So I come back to you, my lovely viewers, once again. To you, Mr. Tufo. You made mention of Inzibani Bebrea, Yebetim Yezizi, na Nzibano Nsede Yezi. What will be your last recommendations or any few words that you like to tell our viewers out there?
Right. See, a few things are mechanic there. Say a diabetes how to ensure there intimate did intimate enjoy in the banner or around and our food options be limited on your no car. Betim I diabetic na maintain a normal healthy eating planner. Obema wo risk of diabetes no obe cause further problems no wakofum. Ibium ediba no so osonde wankasa atena ho na ede wadwena afefa ho na akoye bibia e feel do you okay mo so dem make earlier no ebu ha ni patient ni di nkomo a ebeta ne de monom milk what's minja milk nom osande oba ha ma adwen so many food options are what are we di personally wankasa obeka chodo major AED so ebe hu dietitian a adekra ye de obefam ne de ye be kyerɛw ekwana ebe fa do ebe didi a bit maintain a normal healthy lifestyle without breaking the bank and other without doing so much different things from all regular diet and ma tire na ye be dan ya modify na mo nti nimdi ne hia pa mesre de e be nya nimdi no inya nimdi ni wi a betim abomodena na apply nimdi no what's knowledge is power. I mean, we believe there knowledge na ehune right application na onye powerful them. The right application of knowledge is power. It's bomodena nya dietary knowledge na hu most be apply dietary knowledge the right way na wa boa na wa influence and wa improve your nourishment na your health.
So much. To you, Mr. Lati.
Okay, thank you very much. And I want us to look at the complications on any other mechanism that if you have diabetes and you don't know you have it, there are things that could happen to you. One has to do with it can affect your sight, your vision. So there are a lot of people with diabetes having blurry visions or even have gone blind, and that is because they didn't know that they have it, and the sugar has spiked for a long time and has destroyed what I say in or supply in Yuano. So that is one of the complications. Another thing has to do with the kidneys. So they are also able to destroy the kidney as well, which is diabetes, like hypertension would do. One other one also has to do with it can cause heart attacks. Okay, so diabetes in itself can have negative effects on your heart. It can have negative effects in your blood vessels where it leads to the formation of plaques like the atherosclerotic plaques too. So these are some of the complications that diabetes can. It can even affect a man, your libido. your performance in bed. Same as a woman.
Okay.
Yes. So if you are seeing these things, it's good that we always rush to the hospital or any health facility closer to us and then get our blood glucose checked regularly, periodically. For those who have it, you should have it in mind that if you go and consistently we are telling you that, oh, your blood sugar is 5.4, 5.6, below the 6, it doesn't mean that diabetes is why you occur. Diabetes is a chronic metabolic condition. It stays with you. Continue to do the right things that made you record that 5.6, 5.4 and all that. Don't stop those things. Stick to your medication, stick to the lifestyle modification that you've started or embarked on, and then you will continue to have that normal regulation. But the moment you stop, then problem will come. So just bear in mind that like hypertension, diabetes too is chronic. Won't pass it, you manage. It's in the effort we do. You be able to come and we can prevent you from having these complications. If you're on dialysis, you know how it is. So forget about the what's mommy in the ACH, so you're there and all those things. So I wouldn't visit the dietitian. Please, let's have periodic appointments with them. Even if you are not sick, just go to them and let them help you manage your diet, and then you can live well. My boss is at Escado Hospital. Yes, there are other dietitians in Takrade, Kwesimi Team Takrade Hospital, Escado Hospital. Please, if you are in Takrade, visit these places, see them, and let them help us all. Thank you.
So much. To add up to the facilities they mentioned, Gapua also has a dietitian, so you can visit them and they would also help you, assist you out with all information you need about your diet. Effiong Kwanta Regional Hospital, yes, our own regional hospital also has a dietitian available for you that you can talk to anytime that you go there. Our boss made us understand that knowledge is power, okay, but it is not the knowledge alone, but the knowledge and the practice is what brings about the power. So please, I made you aware in our introduction, we can't buy good health at a provision store, but we only have to abide by doing consistent good habits, just as we've been taught or we've learned today from our dear guest. And this will help us to attain good health. I'm sure from our discussion, you've gotten to know the need for us to really visit dietitians. Mr. Home, my enkade ye pa. So for those of you who would like to see a dietitian, we have one in our mail, so he will put his contacts online, then you would contact him for any other information that you would need. So back to you, Mr. Tufo.
Right. So for, my contact is 054 33 406 39. 054 33 406 39.
Thank you so much. So you can contact him for further information that you need to know about your diet in order to help you manage diabetes. Please not to forget to like, share, and subscribe to all our social media platforms. I am in the person of Miss Nseidu, and I was your host for today's edition. You can look on our screen. There's a number beneath to please do well to support us by sending in your donations to the number beneath our screen. We'll catch you same time on Health Matters Show, and as usual, we will come your way with another educative, fun, and interesting topic to learn with you. It was great having you, my lovely viewers, on this show. We are looking forward to having you more often on our show. And to you, my new subscribers and then our old followers as well, God richly bless you so much. Do what to keep on sharing. Bye.